Meanwhile, tonight, Channel 2 investigates a doctor using a controversial drug to treat some coronavirus patients at a nursing home in Texas City. Some say without their consent. Good evening. I'm Dominique Saxa.
And I'm Chris Gutierrez. Last week, we learned that some patients at the home were given hydroxychloroquine, a drug used to fight both malaria and lupus that many tout as a way to help fight COVID-19.
Channel 2 investigator Joel Eisenbaum talked to the doctor and has more on whether this is ethical or even legal.
Inside this Texas City senior living facility, there's an incredible cluster of COVID-19 infected people. From residents to nurses, 83 confirmed positive in all, including 87-year-old Helen Idrozo.
Mom has dementia, so it's difficult sometimes.
What they've got at the 135-bed nursing home called The Resort at Texas City is a life-threatening problem. And the attempt at a solution is either bold or reckless, depending on your perspective.
Don't you worry about the flip side if something were to go wrong?
No, certainly not a laboratory. These are old medications that have been around for some time.
What's happening here is a living, breathing, live human study using the malaria drug hydroxychloroquine and antibiotics to treat COVID-19. The president, you may have heard, likes the idea.
The chloroquine, I think it could be something really incredible.
But the actual scientific research behind the treatment is still thin.
At this point, nobody knows whether it's going to be effective.
The FDA has not approved hydroxychloroquine to treat COVID-19, but it is licensed for human use by the FDA, and that's an important point, says Galveston County's top health official.
From an ethical and legal point of view, again, as a physician, I can prescribe any drug that's licensed by the FDA. And if I do a bad job of it, well, there may be, some civil consequences, or the licensing boards may weigh in on that.
Larry Idrozo claims his mother was prescribed the 5-day hydroxychloroquine drug regimen without her consent and without any other family member's consent.
Typically, for changing medications like this, adding medications, we don't, it's not a requirement that we get consent for this.
I was a little disturbed to see that the doctor said at this stage consent was not necessary. I have never heard from the doctor.
Dr. Robin Armstrong is the medical director at the resort at Texas City. He says of the 39 patients who took hydroxychloroquine at his direction, only one has died. And that patient only got the drug combo for 1 day, according to the doctor.
I think that we can all be very, very satisfied that there was a positive outcome here from these folks.
Armstrong freely admits he secured hydroxychloroquine through a political connection. And employing it, he says, saved his patients' lives and largely kept them out of the hospital. But to try an experimental therapy without a patient or family's consent, is that over the line?
I would urge the family to talk to the doctor and to reach out some more and try and get some direct answers to their questions. I think as physicians, we all owe that to our patients.
It started last Saturday. It should have been over Wednesday. And now it's Monday, and I still haven't heard anything from a doctor's office.
Dr. Armstrong, the prescribing doctor, says he doesn't need additional consent to prescribe hydroxychloroquine. But he says whenever possible, he did have conversations with his patients about the treatment. Joel Eisenbaum, KPRC, Channel 2 News.
Thank you, Joel.